Hey guys, it's Dr. Cotton with you today, and we're going to cover some self-mobilization techniques for the ankle joint. So the ankle joint is one of the most commonly restricted areas that absorbs a lot of compressive forces throughout the day. Having limitations within the ankle joint can lead to altered patterns all throughout the kinematic chain and leaving you with discomfort at the knees, hips, or even low back. In turn, this is going to influence any kind of running, jumping, squatting, lunges, or even performing day-to-day activities such as stair climbing. Check out these exercises and techniques that you can do to restore some mobility within the ankle joint and help you to perform better. When we speak of ankle joint mobility restrictions, one of the most common places that we see in the clinic for patients to have limited motion is within the talocrural joint, which is this joint right in through here in regard to the calcaneus, and then your tibia. Your fibula is on the side there. We're actually looking at this joint space right in between where your talus, this little small bone here, is going to sit. So what happens in several cases is that little small bone, that little talus, either gets stuck, gets shifted. Oftentimes it can be shifted forward. So doing some joint mobility techniques by your therapist or yourself can actually help to restore that motion, creating an increased amount of dorsiflexion. So what's normal dorsiflexion? So research tells us that normal dorsiflexion is anywhere from 15 to 21 degrees of dorsiflexion. So without that amount of dorsiflexion, which is going upward, trying to flex your ankle that way, you're going to be limited and compromise your knees to some degree, or even your hips or low back. So that's pretty important, especially for running, jumping, squatting, and all those activities that we mentioned earlier. So what I do want to start off with is actually showing you a way that you can measure the degree of dorsiflexion that you have. One way that you can measure the amount of dorsiflexion that you have is by taking a fist, placing it against the wall. You can have your thumbs facing towards you and just staying consistent every time. So with this, you gotta make sure that your toes and feet are straight facing forward. You maintain contact from the heel to the ground. As you shift your knees towards the wall, you should be able to touch the wall. Now, if you find yourself with the heel coming up before you even touch the wall, then you're going to be a bit limited. Okay, so one other thing that we want to ask is, where do you feel the restriction? So a lot of times patients will do this, go forward, and they feel more limited in the back. Well, that tells me that it may be more of a soft tissue limitation. So they could be a bit more restricted with tightness in their gastrocnemius, their Achilles, their plantar fascia all the way down to the bottom of the foot. But a lot of times what happens is they'll be restricted with pain or discomfort in the front side of their foot. So in any case, you definitely want to address that limitation. So a few different things that we're going to be using today is going to be a super band. You place that band just below these two bones on the side called your malleoli. And to keep that band in place, you're going to actually scoot your foot forward, have that band supported from the back like this. Of course, I have my socks on, but it's best that you do this without the socks. You place one hand up on top of the band to prevent that band from sliding up, and then you can shift your knee going forward, maintaining contact with your heel to the ground. So this is going to offer a nice stretch to the talocrural joint as you do this for a couple minutes until it feels like it's easing up, and you can get a little bit further and further each time. Following this, I like to do something a little bit more functional. So having your foot up on the box, and then still keeping that band just below the two malleoli on each side. As long as that stays in place, you can work on stepping up Bring that leg to a high knee position. Come down slowly, and then go back up again. Performing knee drives. So in knee drives, you take a measure with the foot away from the wall. And then the goal here is really trying to aim your knee towards that wall, see if you can touch it, and then come back. This can be performed with a count of 15 reps, 2 sets. And as you notice, I'm getting closer and closer each time without my heel coming up. Okay, lastly, we're gonna do our retest. We take that fist away from the wall, staying consistent every time. Our goal is just to aim our knee towards that wall and then come back in. So as you notice, I can get a little bit closer for myself. I'm still just a little bit limited. But for me, I actually have more tightness in my calves, so I need to get those worked out.